Hey, welcome to my channel. Today I want to look at validation in sterile processing. What is validation? So validation is the backbone of sterile processing. It transformed it from simple a cleaning job into a rigorous scientific discipline. Without validation, there is no way to determine patient safety. Therefore, validation is non-negotiable practice. Validation is also the primary defense against one of the most significant risks in healthcare: infection from a preventable source. So, we're going to look at the importance of validation. One, which we already stated, that patient safety, that's the primary reason, because it's all boiled down that how we keep our patients safe from any healthcare associated infection. Secondly, the prevent of toxicity, because we use chemicals when we're reprocessing our trays. We have to look at instruments when they come from the OR to see if there's any blood tissue left on instrument. And we have to ensure that we are practicing the correct procedures when we are reprocessing. So, and the next step is process reliability and consistency. This eliminates a series of guesswork but guarantee a reproducible science process. Regulatory and accreditation compliance. We adhere by strict standard, which is mandatory in all healthcare facilities, and these mandatory bodies are FDA, Joint Commission, AAAHC. So they gives the guidelines as to how these instruments or chemicals and stuff is to be used, how to be reprocessed, and we follow those guidelines. The legality of this department is just in case if there's adverse outcome, meaning that, say for instance, a patient goes into the OR, they came back with an like sepsis, that's well popular infection that people normally have after they have sepsis or stuff like that. So what AAMI does, or AON, what they do is that they come into the facility to investigate whether we followed the proper procedures and guidelines when it comes on to the surgery. So it goes from our department looking at how the instrument was sterilized, how the instrument was reprocessed. So they look at all those stuff. There's documentation that will show you if these met the parameters, like the time, temperature, exposure time, exposure, if it the sterilizer went through the process, the correct pressure. So all these things are looked upon to see that if we follow the correct procedures and guidelines, because this is the legality, this is the scientific aspect of the job. So we have to follow those guidelines. So validation is basically going to see that we are following all the guidelines set and making sure that whatever, when we sterilize, when we prepare our packages, when we clean from decontamination, the temperature is right, the timing is right, the exposure time. So all these stuff are placed into consideration. Also, for validation, staff competence. So validation also establish that the staff are following the correct procedures as it relates to reprocessing. It builds confidence when sterile processing technician knows the equipment and the processes. Validation reinforce the importance of their meticulous work and give them confidence that they are truly protecting patients. So that is the importance of validation. Validation is the most important aspect of our job. It's to make sure that our paperwork are in line and our procedures are followed. Thank you again, and I hope you enjoy this content. Please make a comment if there's anything that you need to know. Thank you.